So what do you, let's say a patient comes to you, what kind of techniques can they use, or what do you, meditation, or I mean, what kind of techniques they can use on a psychosocial, psychological aspect to kind of try to deal with this diagnosis? Is there any kind of tips you can give to some of the patients who are going through it?
Well, often what seems to help the most is to look back in someone's life and see in other times in their lives when they've faced challenges, like what has helped them through those challenges. It's hard to all of a sudden, develop a new coping strategy in the midst of a crisis. So for some people, if they've had a meditation practice, making sure they stick with that. If they've had an exercise routine that is stress relieving, sticking with that. Reaching out to friends and family is often a sort of a universal way of getting support. Faith is another frequent for folks who have had a real spiritual or faith-based life, that not giving that up right now is a good idea. And then certainly seeking out more professional help for a lot of folks is helpful, whether it's with psychologists, psychiatrists, social workers, sort of peer-led support groups or more professionally led support groups. Again, it's a variety.
That's very important. So if you need help, ask for help. I think that's the important part. So Roni, I know it's been about 3 years, but do you remember kind of anything in that first week about emotions or what you were thinking about, what was going through your head when you were just diagnosed? Was it exactly like Dr. Hurst said, like a gut punch, and you were like, whoa, my life is stopping, I need to find somebody to treat this? What kind of emotions went through your mind at that time?
I honestly don't remember the emotion. I know that it was terror, though. I'm sure it was. And just trying to find some kind of control in a situation where I didn't feel control. And for me, that was found in researching it. I did go on the internet to very reputable sites. I went to the JAMA or ASCO, ESMO, OncLive, I think, where they have actual physicians talking about it and talking about the research. And one of the things that helped me navigate the journey was to realize that there are a lot of new therapies coming up for ovarian cancer. So having ovarian cancer today is much different than having it, say, 10 years ago. And so that brought me solace, but I'm sure I drove Dr. Iskander crazy because I was just like, what about this? And what about that?
Is that how you remember it?
Actually, exactly how I remember it.
I don't want anybody in the hot seat, but I think you're right. There is a lot of kind of emotions and everything which go through, and you're right. Sometimes there is, Dr. Hurst, like you said, there is some denial, which would be in all of us, kind of looking at saying my life was really going well, was perfect, and then suddenly this is, I have to readjust my life to kind of deal with this. But I think, Donia, what you did was exactly, was close to perfect. You kind of researched it a little bit, you took good advice, you found a doctor whom you were confident with, and you kind of followed the path. So that was amazing. So tell me this, Donia, I'll start with you. So if there's kind of a couple of pieces of information that you could relate to somebody who's just dealing with ovarian cancer, let's say somebody who's just had a diagnosis of ovarian cancer, and it's all new to them, what kind of advice would you give them?
Well, I think just what you said, finding a doctor that you know you can go on this journey with, that you can trust. And Dr. Iskander, I don't know if you still do this, but I got a text number that I could text him, and he said, I do this for all my patients. You're not special. This is what I do.
You're special.
And so that was, I just felt I had a connection, a lifeline, that I knew we're in this together. He's invested in me, I'm invested in him. And I would encourage patients that's everything, is finding a good doctor at the very beginning, and then doing the work, that's showing up, getting your scans, doing the chemo, following all the scientific work that's been laid out before you began this journey. That would be number one. And number two is I would try to worry a little less. I mean, I don't talk about it, but I know at night seemed to be the hardest time for me. And I remember the tool I use, because I don't really meditate, is I can remember coming up with I am safe tonight. Tonight, nothing's going to happen to me. I can go to sleep. Just rest. Don't worry about tomorrow. And so that thing of I'm safe tonight.
That's amazing.
I would tell myself.
Dr. Iskander, what what information would you relay to a newly diagnosed ovarian cancer patient?
I echo a lot of the things Donia just mentioned. I think communication is critical. Patients are coming into this with a new diagnosis, like Dr. Hirsch just said, fearful, apprehensive about what may come, worried, especially in the context of an ovarian cancer diagnosis. But communication, finding a physician that you feel like you can truly reach out to, the dialogue is an open dialogue, spends the time that's needed to talk to you and your family throughout this process, and also to have some degree of faith that this process is going to move forward. There will be steps along the road. We may run into some bumps in the road, but we'll get beyond them. And I echo what she just stated as well. I had another patient who said, taught me a phrase, "Don't borrow trouble." So, and I learned it and I use it a lot because I think it's really meaningful in this disease that we treat, ovarian cancer. We don't know what's going to come. We don't know what's going to come in a month, in a day, in a week. So where we are right now is where we want to be. This is where our focus and we'll exert our energy at this stage. And then we will revisit this as we progress along the course of your therapy.
That's a really good one. I'll remember that too, Dr. Hurst.
Yeah.
What advice would you give somebody who's just newly diagnosed with cancer?
I think reaching out to those around you is important. Certainly finding a physician that you have a good connection with is important. And worry is normal, but it can get in the way if you're worrying all the time. So I think that technique of, okay, right now I'm okay, right now I'm safe is appropriate. Having time to worry and then sort of setting it aside so you can move on with the other things you need to do and get sleep and whatnot is important. But for a lot of folks, not keeping it a secret is helpful.